An international team from the Red Cross says it will try again tomorrow to enter Mariupol, the southern port city under siege where nearly every single building is either damaged or destroyed, and officials fear tens of thousands may be dead. The aid group said that conditions today en route to Mariupol made it impossible for a group of 9 to get there. The Red Cross spokesman told the UN today, and I quote, "We are running out of adjectives to describe the horrors that residents in Mariupol have suffered. The situation is horrendous and deteriorating, and it is now a humanitarian imperative that people be allowed to leave and aid supplies be allowed in." I want to bring in now Helena Skopalska. She is the Ukraine country director for Health Right, a humanitarian organization that works on providing shelter, food, and crisis counseling. Helena, we're so happy that you're on. Thank you so much. It is believed that about 100,000 people are still in Mariupol. Tell me what other areas are you helping, and what are your teams seeing and experiencing there?
Good morning. Health Right International has worked in Ukraine since 2005, and we have more than 120 staff in Ukraine, psychologists and social workers who help to people who faced this humanitarian crisis. I would mention that as for March 13, there are around 10.5 million people. It is more than a quarter of the Ukrainian population that have been forcibly displaced by the ongoing war conflict, including nearly 6.5 million internally displaced. Can you imagine? So we are not speaking about those who were, I would say, lucky to left Mariupol, but also about those who now try to build life from the beginning in our places in west of Ukraine, where our organization is working now, and through provision of specialized services, we call them mobile teams of psychosocial support for those who face trauma and who come to new places to live.
Yeah. So Health Right has been, Helena, Health Right has been transporting some of the residents using those designated humanitarian corridors. Have you faced any of the obstruction during those missions? I would emphasize that we help to those who live these places where are very hot places and provide psychosocial services. So we, of course, collaborate with other organizations which provide these corridors and ensure safety during this way. But important is that our specialists, for example, each mobile team consists of psychologists, social worker. Now we add mobile teams nurses and also lawyers. They help to families who go to other places and start to live there. Yeah. So you mentioned psychosocial services. And I know your organization helps with that and some crisis counseling. What have your teams been witnessing there and in Ukraine among the displaced who have fled?
So we know that, and we expected that there will be significant increased demand for mental health and psychosocial support. And this is a main service which we provide, but of course we help to people also to find a shelter, safe shelter in different parts of Ukraine, or to help them cross borders. And we are talking now not only about adults, for example, but what makes it worse about adolescents and children, because you know that usually internally displaced people are women with children. So it's important really to provide MHPSS services for all these people who are internally displaced in Ukraine. And mental health services are very different, and scope of work of our specialist psychologists, it's much broader. For example, our one of coordinators from Volnovakha mobile team, he just helped to set out and created bomb shelter in his village. He for example, persuaded neighborhoods to bring together drinking water, food, warm clothes, and with one time up to 50 people used this shelter for more than 2 weeks. Volnovakha, it's small village in east of Ukraine, and about 100 people stayed there in basement. So he provided psychological support to them, but also other important services and shelter during
Helena,
2 weeks. So it's difficult to imagine.
Yeah, well, we're happy that you're dealing with that and that your colleague was able to get help. We've been hearing so many stories, and you're right. These folks need a lot of help, including psychosocial services, as you mentioned. Helena Skopalska, thank you so much. We really appreciate you joining us.